Hey vlog, it has been a minute. I stopped recording because of a few reasons. One, AEP, annual election period, is in full swing, and so is OEP, open enrollment period. Both of them are full swing right now, and things are crazy. Not only that, but I've also been sick since last Thursday, which would be October 29th. And I don't know if I have the coronavirus or not. I think I do. I had a fever only for a little part of one day. But I can't really taste or smell anything. It's really weird. And I have a sore throat. So we'll see. I've been putting off the test just because I don't want to know, I guess. And nothing would really change. I wouldn't really care. To be honest, I can still work from home and do everything I need to just from my laptop and my phone. But yeah, that kind of stinks. It makes me, I'm curious if I have it. I'll put it that way. I'm kind of bummed because I could have made so many videos. Halloween was a blast. I could have done some cool information about my costume, or mine and my girlfriend's costume. But I figured you probably wouldn't really care too much about that. But I've just been super busy and super kind of lazy because I've just been trying to take it easy and trying to rest up and eat a lot of vitamins, eat good healthy food like I always do, and drink a shitload of tea. But I'm coming at you today with a video that I find really, really interesting. Because ever since I saw Medicare Advantage plans, I always joked, I said, man, I wish I could have one of these plans, because truthfully, I love Advantage plans. I hope you sign a scope of appointment so I can talk to you about them. That's an insurance joke. If you don't get it, then too bad. But I love Advantage plans. They're dirt cheap per month, and then you just have co-pays for services. So maybe $20 a month to have the actual plan. Then every time you go into the provider, it's a $5 copay or a $40 copay if it's a specialist. Emergency room copay might be $250. A MRI might cost you $200 copay. X-ray might be a flat $50 copay. So I love these plans because it kind of spells it out for you up front exactly what each service is going to cost you. And those plans are obviously just for those that have Medicare. So people who are 65 or older for the most part, or people who are under 65 and have certain disabilities. But one of the two companies, because there's only two companies in Nebraska, one of the two companies that do Obamacare plans in Nebraska for 2021 came out with this plan, guys. And I'm going to turn the camera around and show you because it is basically like an Advantage plan. So real quick, just to show you, I have an Omaha zip code here. It's about around Exarban. 30-year-old male or female, I guess, doesn't matter. With a household income, basically a household income above the threshold for where you could get a tax credit. So I'm going to be showing you the full cost of the plan here. Realistically, most Affordable Care Act plans or marketplace plans are super expensive, obviously, if you don't have a subsidy. So this is just to show you the plan benefits. So here is the plan benefits, guys. It is an expanded bronze plan. Starting off, first thing is $396 per month, monthly premium. That seems like a lot, obviously, and it kind of is, but I mean, people don't really get Affordable Care Act plans if they don't have a subsidy usually, unless they have a lot of pre-existing conditions. So keep in mind, obviously, if your income falls within the certain income range of federal poverty levels, then you can get a tax credit, and this will not be $400 a month. And then craziest thing is this deductible right here, guys. A lot of Advantage plans, a lot of Medicare Advantage plans don't have a deductible, and neither does this plan. Again, I'm just using the comparison. This isn't a Medicare Advantage plan. This is an Affordable Care Act marketplace plan, but it looks a lot and it reminds me a lot of Medicare Advantage plans. But then you have your typical high max out of pocket, $85.50 per person. Nothing too out of the ordinary there. Doctor's visits, flat copays before and after deductible, obviously, because there's no deductible on this plan. So primary care, $50 copay, $100 copay for specialists, and then of course, because it's a marketplace plan, preventive care is always free. Oops. Then prescription drug coverage. No marketplace plan really has good prescription drug coverage, honestly. So seeing $30 for generic seemed very high, but I always have a free prescription savings card that I give to all of my clients. It's called Clever RX. The link is down in the description below if you wanted to check it out for yourself and shop around and see how much your drugs would cost with this free savings card. So if your insurance coverage for your marketplace plan or group plan or any plan isn't that good, like most plans out there now, most prescription coverage is kind of awful nowadays, unfortunately, check out those savings cards, guys. Moving right along to the labs and imaging, $100 flat copay for x-rays, $300 flat copay for CT scans, PET scans, and MRIs. That is amazing, guys. I had an MRI on my elbow almost a year ago to date, I guess, technically I should say. And it was about $3,000. So having just a $300 flat fee for that service is phenomenal. Then of course, if you need blood work, just a flat $50 copay. And then the big stuff, moving on to the stuff that breaks the bank and puts people in debt. Hospital and emergency room. Flat $50 copay for urgent care, which is phenomenal. $1,000 copay for emergency room. Now that sounds large. You know, you hear oftentimes emergency room usually only costs about $500. So if you do not hit that $1,000 mark, then of course the plan is not going to make you pay the full $1,000 copay. They'll just make you pay for the whole emergency room bill. But if you have some crazy emergency room bills and the bills go above $1,000, then you're covered. You just have to pay a $1,000 copay. Ambulance, you're stuck paying 50%. And that includes, let's see, I think that includes air ambulance too, if I remember right. Hospital stay, this is the most amazing thing. $2,500 per day up to 2 days. So if you're in the hospital for 4 days, guys, you only have $5,000. Well, of course, on top of this next one here, you have $5,000 copay for the 2 days. And then, you know, the physician visits you 3 times in those 2 days and another $900, which is not bad at all. Outpatient surgery or procedure, $1,000 copay, guys. That's amazing. So again, if it's like a $500 colonoscopy, they're not going to make you pay the full $1,000. You're just going to be paying the $500 bill. I guess plus on top, they'll probably bill you separately for the actual physician. So it'd be $800. Then rehab, $100 a session, I believe. So that's a little pricey, but again, that's, I take that back actually, because if it's under that, then they're not gonna make you pay the whole thing. Then mental health and psychiatric hospital stay, pregnancy and birth, and all the free preventive care services for men, women, and children, or adults, women, and children, yada, yada, yada. So there you have it, guys. That's an amazing plan. I'm a big fan of that plan if you get a good subsidy for it. And this one guy, he's 32-year-old male in Omaha, has one dependent, but the dependent is covered on Medicaid. Income is $30,000, I believe it was, for 2021. And this plan is going to cost him $38 a month, which is super cheap and very affordable, obviously, but a great bargain, because this plan is awesome. And I really hope to see more of these plans come out, these Advantage plan looking plans for the under 65 market, because I think they can do wonders, and I think that a lot of people would sign up for them, honestly, because they're simple, they're easy to understand, and they're often a great bang for your buck. But with that, I wanted to say thank you guys for tuning in. Sorry it's been so long. I made a commitment to myself that no matter what, I am going to be creating 365 of these videos at least, just so I can get a full year incorporated into my broker tapes, and so you can see a full year's worth of content and of what it's like to build your own insurance agency, brick by brick, client by client. Because when I started this, I was just leaving my old brokerage and was completely on my own. So it's been a wild ride so far. It's been a very great, successful first year, honestly, and I can't wait to see what else is in store. And if you guys are excited and want to see my journey, then please hit the like button and don't forget to hit subscribe so you can get notified every time I put out a new video. So thank you guys, and I will see you on the next episode of Broker Tapes.